So this is a superior-medial breast reduction. Here I am drawing the markings, and this is what I would normally draw with a skin marker in pre-op holding with the patient sitting up. So I'm marking out the skin and breast tissue that I'm going to excise. Now I'm drawing the pedicle, and this is the tissue that provides the blood supply to the nipple. So the first stage of the operation is to de-epithelialize the pedicle. De-epithelialize means I'm going to remove the skin from it. And you'll notice that the nipple here stays completely attached. The nipple's not removed. That's only done with a free nipple breast reduction. But all of the skin overlaying the breast is removed. And normally I use a 10-blade scalpel and Adson's pickups, but you know, I've got tweezers and a steak knife because we're operating with Play-Doh here. So this would be the right breast, and the patient's head would be up top. Their left breast would be over to our right, and their arm would be over to our left. All right, so I've just about got the pedicle de-epithelialized here, getting off that last little bit of skin. And now I'm going to excise the extra breast tissue. Now, in real life, I would elevate the pedicle, which just means take it up from the chest wall, but that's a little hard to do with Play-Doh until I've removed the other tissue. So you can see the excess tissue comes off the lateral part of the breast and the inferior, which is the bottom part of the breast. And I take a wedge of skin off too. That is going to let me rotate the nipple up and bring those medial and lateral pillars of breast tissue together. So there you can see I've almost got off most of the specimen, and that would be weighed and then sent to pathology, and then I take off that little bit of extra breast tissue. So now you'll see me slide in with the steak knife I'm using and elevate the pedicle off the breast wall, but normally I would do that first. So there I'm rotating it into place. You can see how the nipple actually rotates 90 degrees. So if you have nipple piercings and they're horizontal, they'll be vertical after a reduction. And then those medial and lateral pillars of breast tissue come together, and normally I hold it with a suture. And the skin kind of redrapes and stretches back down. Because I'm using Play-Doh, I have to stretch it out and mush it a little bit. But you can see the end result. The nipple's rotated up. The breast is narrower and smaller, and you have an incision around the nipple and down the front of the breast and underneath. And here I'm just smoothing it out with a little water to make it prettier. I hope that makes sense in a three-dimensional way and you can understand how breast reduction is done.